Prostate cancer is the most common cancer in men. About 1 in 8 men would be diagnosed with prostate cancer in their lifetime. So what actually affects prostate health? One of the largest studies ever done, published in the JAMA, followed 30,000 men over many years. It found out that men who ejaculated 21 times or more per month had a significantly reduced risk of developing prostate cancer compared to men who ejaculate 4 to 7 times per month. This is roughly 5 to 7 times a week, including sex, masturbation, and nocturnal emissions. This doesn't prove cause and effect, but a strong association from high quality data. Prostate health is shaped by age, hormones, and lifestyle, and sexual health may be a part of that picture.